Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And as we normally try to give you the information which you bring questions to us about, and there's a lot of communication to us in the last couple of years about memory disorder. Of course, a lot of people, and we'll correct it here, everybody thinks that everybody's getting Alzheimer's, because that's what they see on television, and they see all these ads for memory products and things of that nature. So I just thought I'm going to bring two experts. And so let me introduce to you Dr. Thomas Crum, who is a neuropsychologist, sitting right in front of me. Welcome, Dr. Crum.
Thank you.
And a proud graduate of our College of Osteopathic Medicine, Dr. Hazel Wiley, who's a neurologist, and she's the medical director of the Memory Disorder Center at Broward Health North, which is right there on I-95 and Semple Road, correct?
Yes, you're
Well,
correct.
welcome. Good to have you here.
Thank you for having us.
Nice to have you back.
It's nice to be back.
Yes. Just in general sense, tell me what the Memory Disorder Center's responsibilities are.
Our goals and our responsibilities are to help families and patients who have complaints of memory difficulties. We take an interdisciplinary approach to evaluating patients with memory difficulties to find out if they have normal, appropriate aging changes or they have a disease called Alzheimer's or dementias.
And Dr. Crum, what is your area of involvement with the Memory Disorder Center?
It's fairly wide-ranging. My primary responsibility is to conduct neuropsychological assessments, to actually measure the cognitive functioning of individuals coming in, to identify if there is a presence of abnormal memory or thinking processes that may need to be addressed. The secondary part of the evaluation is really to help develop compensatory strategies, maybe lifestyle changes, behavioral changes, environmental changes to help that person maintain this highest level of functioning, even as the disease may progress. And if we don't find any disease process, there's also probably the most common reason why people come in for memory disorders just in general is higher levels of stress, depression, anxiety, being able to identify those and offer appropriate treatment.
As you both realize that we're living in a part of the nation, Florida, and South Florida particularly, that has the highest percentage, and my viewers hear this all the time, but I'm going to get to this point. They have the highest percentage of people over the age of 70 of any state in the union, and with the highest number of people over the age of 85. So I would assume that that a lot of the so-called issues relative to memory disorders, and often the viewers will, in their questions or their communications with us, say, I guess I'm getting old, and Alzheimer's is there, and whatever, and everything is always Alzheimer's. And a little later on, I'm going to discuss we discussed it before the show, an icon, Dr. Murray Todd, who said a couple of things to me, but I'm going to listen to you, and then I want to tell you what he said. So, Dr. Wiley, tell me, because I would assume that you're going to get some kind of physiologic data and baselines before, as a physician, so that you know where to go. It's sort of a roadmap as to where you're going. Is that true?
Absolutely. Absolutely.
Well,
and that's what our goals are at the center, is to get people in early, to get them tested early if they're having issues, so we can follow them through. And the earlier the diagnosis, the quicker we can start treatment and hopefully provide more benefit in slowing the disease process.
Well, again, we talk about the disease process. But what is the disease process? That's what these folks are wondering. They're wondering, well, what's happening?
Alzheimer's is the most common form of dementia. And so about 80% of the patients who have dementia have Alzheimer's dementia. So when we talk about Alzheimer's dementia, we talk about plaques and tangles. That's the disease that is damaging the brain tissue or the brain cells that lead to the difficulty with thinking, the difficulty with reasoning, the difficulty with making decisions, and problem solving. So as we age, we develop more plaques and tangles, more amyloid, and more tau protein. And the higher burden of the amyloid and the tau protein, the more symptoms we see as we see the disease progress.
Let's talk a bit about that. What's going on? How is research coming on?
Well, a lot of research is geared towards the amyloid and how do we stop the amyloid from forming and how do we remove the amyloid. We also gearing a lot of research towards the tau proteins. So those are the big areas of focus with research at this time.
Is it concomitant when either one of you can both, I guess, get into this? Is it concomitant with the fact that we're at this particular point in time, we have probably the highest number of people that have lived the longest in our country?
I mean, to that point, our population is aging for a reason. I think our health has been improving over the decades, and it used to be Alzheimer's, the onset was relatively early. We would actually consider early onset in the 60s or even early 70s. Now we're seeing a progression of abnormal memory, abnormal thinking occurring much later than it had decades ago. So it probably to conceptually think about it in terms of our general health, our focus on exercise, our focus on sleep, our focus on diet, our focus on a change in our lifestyle has made, and also hypertensive medications, controlling of diabetes, all these things were outside of the tau and beta amyloid, reducing the amount of health that our brain actually had. So when the disease actually started to progress, there was much less resources for it to attack.
Where are we?
Well, absolutely. Everything we do is controlled by the brain, so that's why it's so important to have good exercise and diet and all the activities that Dr. Crum mentioned, refrain from things that can cause damage to the brain. Because
such as?
Tobacco use, alcohol use, following up with your doctors, monitoring your blood pressure, monitoring your cholesterol levels, making sure you're overall healthy, exercise, I think I mentioned already. Our overall health needs to start when we're young because we see damages as we are getting older, and then we don't see the effect of the damage that we've done over years until we're in our later ages.
I would assume that the people who show up that are 65, 70, and 80 don't have any baseline material.
And that's one of the most important things I think our program does. We have a community outreach program where we would go to churches, synagogues, community centers, and we offer free baseline assessment. We also offer it in the clinic itself, but we will go out to, last week we were at a church and we assessed 10 people over the course of a couple of weeks. Very healthy, normal people over 65. They're engaged in a social community center, but they are concerned about the effects of aging and being able to offer them that idea that, no, your memory is fine. And we can talk about the other possible reasons why they may be experiencing memory issues, stress, depression, maybe they're caring for a loved one and they're overwhelmed. And then being able to offer them those services. Part of something else that makes our program unique is we have a care assistance program. We have a full-time social worker who is amazing and knows pretty much all the community resources. So once we've identified issues, we can refer and be able to provide services in multiple different areas.
So, Dr. Wiley, we have this interdisciplinary approach, which is really As you well know, the founder of our university, Dr. Morton Terry, believed very, very much so in, and he wasn't an educator, but he just saw something in his mind back in the late 70s. He said, you know, healthcare is going to be collaborative, it's going to be interdisciplinary, in spite of the fact that everybody's going to try to protect their own profession, et cetera, et cetera, et cetera. But you, as a graduate here, you know, I mean, we have 8 colleges in the Health Professions Division. We have 41 programs, all right? So, in the Health Professions Division. So, and as you know, both of you probably know, that the reason why he did that is because he wanted for one health professional to involve the other health professional in your decision making. I would assume that you see things that is not necessarily on a chart.
Correct. I mean, through a neuropsych assessment, it's multiple hours of direct assessment with the patient, but also interview with caregivers, with family. So being able to see that person from many different angles allows a neuropsychologist to provide information that wouldn't normally be provided in a direct clinical evaluation.
So, Dr. Wiley, now you were educated in that, what I just said about Dr. Terry and his theory, which certainly has played out. Talk to me.
Yeah, you know, what you say is what we do at the Memory Disorder Center. We have a multitude of people who all work together as a team. It starts when the patient first arrives to the center. We have nurse, we have social workers, we have Dr. Crum and myself, we have a geriatric psychiatrist, and we all work together in evaluation of the patient. But something that's very special and unique about the center is that we don't just focus on the patient, we have a team that focuses on the entire family. Because with a disease like dementia and Alzheimer's, it affects greatly the entire family. So we have the time and the ability and the resources to be able to treat the entire family for this disease.
You know, I was just thinking about the last time we did an interview with Dr. Todd. He was sitting right there, and I said the following.
Here we go.
Yeah, I said the following to him. I said, you know, I forget people's names. And he said, no, you didn't forget their names. He says, you know, just keep on talking in the subject matter. It's going to come to you maybe 2, 3, 4, 5 minutes later. It's going to come. He says, that's the way it is. He says, you know, I can't tell you why the brain won't give you that information right away. He said, but you didn't forget. And the problem with most people, he said, is that they panic. They panic. And he says it's most obvious in situations where people are in an adult living facility or they don't have the companionship of their, what I would call their traditional family. You know, they're retired, they live here, they have a son in Chicago, a daughter in New York, another daughter in San Francisco, and you know, you're not together, and it affects something. He didn't know what the something was, but he said, don't worry about it. Is that oversimplistic? But is it true?
Absolutely. Panic, anxiety, depression can all cause us to be forgetful, not store memories or episodes that happened. And it doesn't mean you have dementia. We all forget. We're all busy and multitasking. We try sometimes to do too many things at once, and our brain only has capacity to remember so much. And that also sometimes causes us to forget people's names or certain things.
Well, those certain things, Dr. Crum, what are some of those certain things?
Well, especially if we are attempting to multitask or we're involved in our own dialogue inside of our mind, when something else of importance comes in front of us, we're still paying attention to what's going on in our mind, not necessarily our environment. And that is one of the strategies we attempt to use to help people improve their memory, is using mindfulness strategies to focus on what's important now, what's going on in your environment. It also is part of the strategies when we deal with management of anxiety and depression is that the psychotherapeutic process of really being aware of what is going on and how you can address your immediate environment. Sometimes our internal dialogue is going to be our worst enemy and going to interfere with so much of what would actually be important to remember.
Yeah, he again, sitting right there, he said, the psychological panic doesn't help the situation. Yeah.
And I kind of feel that right now in this situation. There's a competition for resources, and as your stress gets higher, that competition becomes more fierce. And if you're not sleeping well, the resources drop. And if you're not taking care of yourself, you're not exercising, resources drop even more. So you have a higher competition for dwindling resources. And that it is a recipe for just having difficulty. And that's the difference between, I think, the normal experience in our daily lives and when somebody does start to move into a dementia process, that is no longer really the case, that the resources become so small, even in the best case scenario, that there is some loss of the ability to pull up old information or even more recent information. So that's kind of the diagnostic aspect of it, is where we're trying to define, well, this is normal, and this is normal for this person's experience, for their education, for their stress level, or no, there's something else going on and we need to address that now. Most of the recommendations I can give people, I would give whether they have a dementia, Alzheimer's or not, is that self-care. Take care of yourself psychologically, take care of yourself physically, and either way, you're going to show benefit.
Dr. Wiley, let's give some definition of, shall we say, proper sleep or sleep in itself, and also to the issue of you said exercise. What type of exercise? I mean, what are we talking about? I mean, these folks always say to me, well, I just want to sit around and I want to do this or sit in front of the computer or, it's an interesting thing because we'll talk about it after you tell me. What do you mean by exercise and sleep? That seemed to be, Dr. Todd hit on those two issues more than once during our conversation.
Sleep varies. You can have a range from anywhere to 6 to 8, 9 hours of sleep can be considered appropriate sleep. Some people need a little more sleep than others to be able to function, so it's really dependent on the person. When you talk about exercise, because our population that we're seeing have more physical issues, we have to be sometimes creative with exercise. What does exercise mean for them? And so when we have patients who have limitations with walking, or they have canes or they have walkers, we try to find activities or exercises, whether they're seated, they can still get the physical activity, still get their heart rate up. That can be helpful. But for patients who are more mobile, things as simple as just going out for a walk, getting your heart rate up on a daily basis is sufficient.
That's a very interesting thing, and I would assume it happens with both of you during your inquiries of the patients or the people you're caring for. Walking seems to be an issue of the past. We have this wonderment of these communal housing communities, condominium associations, gated communities, whatever. Very rarely do you see people walking. They'll get into their car or get into someone else's car, go to a venue, whether it be a mall or whatever, although a lot of malls are closing, but there used to be a lot of movement activity, physical walking in most of these malls. And I'm just wondering the effect that it's going to have on us. I mean, so much of our, because it's the younger generations dominantly, although I don't believe that it's only limited to the younger generations, but a lot of people are not shopping anymore. Not everything. a good amount is being delivered, everything from food to pharmaceuticals to things from Home Depot and Lowe's, and you see it on television all the time. I mean, I just saw an ad just this morning from Ace Hardware. You don't have to come in. Just tell us what you need. You need 4 screws and a nut and whatever, and a hammer or whatever, and they deliver it to the house. Well, that means that you're not walking out to wherever you're going. You're not walking even oversimplistic tasks of walking through a parking lot and walking through a store, to try to find it. It's got to be interesting to see, because exercise to me is not just going into a center or one of these workout venues. It's just normal daily human responsibilities.
And that's what we try to encourage people to say, take your daily normal activity and increase it. Because you're right, a lot of people think that exercise means you have to go to a gym, or you have to go out running, or you have to lift weights, and a lot of our patients can't do that. But there's a lot of other activities, something as simple as walking, like we said, that can still benefit your brain just as well. But aside from physical activities, we also encourage a lot of mental activities. So reading books, reading magazines, short stories, learning a new language, learning to play an instrument, puzzles, Sudoku, anything that can cause or that can help with mental stimulation, because that's something else that is also beneficial to keep our mind working.
And again, getting back to the issue of sleep, is it a continuous sleep period, or because there's a lot of I'm going to take an afternoon nap, or even younger people come home from work and I'm going to lie down for an hour or so. Is that part of the sleep process, or is it not?
Well, I think one of the things about sleep, the World Health Organization just had a conference, and that was one of the highlights that I was not expecting. They really focused on sleep, and they actually recommended up to 9 hours of sleep, which is amazing for somebody to do that. They do recommend continuous sleep, but that is a lot of times outside of anybody's control. Whether you get continuous sleep or not, that would be a wonderful thing, but it's not likely going to happen. So really having that sleep and trying to have it as without the disruption as much as you can. Afternoon naps, I think for the most part, if it helps that person become more active in the afternoon and it eliminates sort of that lower level of activity in the afternoon, so they have a brief rest and then increased activity, is probably a wonderful thing.
We're down to the last 2 minutes of the show. Firstly, tell everybody where you all are located, Doctor.
We're located on Sample Road and 95.
Right.
And we've been there since 1987.
Right. Well, you've been there since 1987, thanks to the advocacy of wonderful people like Dr. Murray Todd. I mean, I remember him traveling all over the nation trying to set up the standards for certified stroke centers, and of course that was the first in the state of Florida. And how do they get to you? I mean, tell me. I mean, did it have to be referred, or did they just walk in and seek information?
So either way, they're usually referred by their primary care physician, but they can absolutely just walk in and schedule an appointment to be seen, or they can schedule an appointment for the screening, the memory screening. And if we see difficulties there, we can schedule an appointment to be seen at the center.
So there's direct access. For example, I mean, Medicare and all the other plans, they give you direct access, so you don't have to go through your primary care physician?
Most of the insurances.
Yeah. No, I mean, but Medicare,
correct.
I'm sure, right.
And the secondary mode to even use the center, not even being a patient there, is for the caregivers. We have a care assistance program that is 12 to 16 hours of education, which occurs 10 times per year. It's free of charge. Caregivers can come in, they learn about financial planning, legal planning, stress management, community resources. There's a huge amount of information that's provided. And that also, just walk in. I need help, my caregiver has memory issues, and we'll take care of you.
Well, thank you both for being here today. You both are at the Memory Disorder Center at Broward Health North, and I appreciate you, Dr. Crum, and I'm glad that we gave you a little more education here at Nova
Thank you very much.
We appreciate it. Dr. Thomas Crum, neuropsychologist, and a proud member of graduate member of our College of Osteopathic Medicine, Dr. Hazel Wiley, who is a neurologist, and we need more neurologists. You know that, with all due respect to all the other things that we're doing. But you're the medical director of the Memory Disorder Center at Broward Health North, and I thank you. I thank you both, not only for what you do, but for your advocacy. I know what you do out in the community, and you sure are to be blessed for what you do. So thank you both very much. Folks, I hope that we answered some questions. It is a difficult subject area because there's so many things to ask about dementia or loss of memory or whatever you might think, and everybody begins quickly to think that they have Alzheimer's, which is not always the issue. But just remember that we're just trying to make things easier for you. You've got to talk to your physicians. I tell you this all the time. You must talk to your physicians. If you have a problem, you got to talk to the physicians. They're the ones that are going to seek to make these folks' services and other services that are available to your knowledge. So you have to take them up on it. Don't just sit there and worry about the future. Let's worry about what happens now. And the way you do that is by taking good care of yourself. This program is called Dateline Health. We come to you from Nova Southeastern University. And if you have any questions or comments, there's a telephone number and an email address. And remember, I always say, take good care of yourself. My name is Fred Lippman. Until next time, see you.